another episode of Health Matters, the cable access TV show that's jointly sponsored by WCCA TV, public cable access here in Worcester, and the Worcester District Medical Society, which, as you know, is celebrating its 225th anniversary this year. So I'm your host, Mike Hirsh. I wear a bunch of different hats tonight. I guess I'm going to talk as the Division Director for the Division of Public Health for the City of Worcester and 6 surrounding towns. But I really am thrilled about this particular episode because I have my best friend here as a guest, Dr. Matthew Masiello, who has also worn many hats over the 35 years that I've known him. He's a pediatric whiz, a pediatric intensivist, a public health advocate, and he has worked for the World Health Organization. He has worked for many pediatric organizations, for pediatric rehabilitation services, and most interestingly, and I have to admit I can't keep up always with his latest endeavors, he has become certified as a climate change expert with a particular bend, and I'll let him explain more, to the public health aspects of climate change. So, Matt, welcome.
Thank you, Mike.
It's great to have you.
Great to be here.
I heard your grand rounds a few weeks ago at UMass in the Department of Pediatrics, and I think you are much bigger than a canary, but you are, to me, singing the canary in the coal mine song here, because the dangers that you pointed out about climate change and how it was going to affect public health and how it was going to affect individuals and the physicians that care for them, I think was very frightening. And I don't want to frighten the people, and I think that you don't either. I think you want to alert them that there are things that we can potentially do individually and collectively to potentially mitigate some of the catastrophic effects of climate change. But tell me what got you interested in taking this on. What was there, like a aha moment where you said, I've got to dive into this? Because you've dived into gun violence, you've dived into services for the disabled child, you've dived into child advocacy for the abused child, and now here you are.
Mike, I think it was very much like that. We both very much appreciate the situation where health is beyond what we do in a hospital setting. Really, what we do in a hospital setting affects only 15% of anyone's health. So you and I, 35 years ago, pretty much embarked on the path of what else can we do to protect our children and keep them healthy. And like you, have had the opportunity to delve into different areas, some with intention, some without. The issue just happened to be there, and we were asked to participate in those situations, and fortunately, over the years, we found funding to support that. I think we all became somewhat familiar to the issue of climate change probably 10, 20 years ago. And it's become certainly more of an issue for 2 reasons. One, the science is here now right in our face. And the politics of climate change is right here in our face as well. And I just felt it was time for me as a pediatrician, as a parent, as a public health advocate to take up the banner, because what I was seeing was that we healthcare professionals, especially physicians, are not moving as fast as we need to be, and I think we physicians probably realize that. So what can I do in my role as someone who has an interest and background in public health to propagate all of this? So as you mentioned, I went back to school and participated in the Yale program on climate change, and garnered some additional knowledge and did some studying and work in that area, and hopefully now I'm on the path to educate others, whether it's our colleagues or schools or communities.
So just very simply, I mean, taking the politics out of it, the science clearly shows that there is an alteration of our climate very much caused by human activity. And it seems that the necessary steps on a very, very broad scale, Paris Accords, which we just formally withdrew from, are kind of spitting in the ocean in a lot of regard. But individually, you see a lot of the youth coming up with this as a number one concern. And the youth shall lead us. They always seem to kind of get it before the old farts do. What can we do to do that propagation of information, and what steps would you take if you really defined, well, let's do this. Let's define climate change and then say, how can an individual impact climate change?
Well, you would think the phrase climate change would be so simple of a phrase to latch onto, but in fact, it's created some challenge for us in that people, and appropriately so, still equate climate with weather. Weather happens today. Climate is what happens over the past 30, 40, 50 years, 100 years. But for many of us out there, we don't make that distinction. So when we hear about climate change, people are feeling that, okay, it happened yesterday, it was very hot this past month, and we're going to have a snowstorm next month. So really, how can I try to comprehend this? Probably the best phrase to use is global warming. That makes it much easier. And even if we want to make it less controversial, global warming, even those who dismiss the issue of climate change probably will agree that global warming is happening. The challenge or the controversy lies in, well, are we humans responsible for that? But let's take that, let's move that out of the equation for a moment. Global warming is happening, and it's already, as we know, created a significant public health issue for millions of people across the world, and even in our own country. We get into some specifics in the middle of the conversation. So the first thing to do really is let's try to understand, and appreciate the definition of climate change and global warming. That's probably the best thing we could do, and that's really was my first go around in the lectures that I'm giving now. What is climate change? And it's global warming. And what can we do to get to your even further beyond trying to understand the definition is really try to put it at the top of our mind now. Whether you're the 15-year-old international advocate or the 15-year-old just student sitting in a science class or the science teacher of that class, start moving the topic of climate change further up in your thoughts, and let's talk about it. That's probably the best thing we could start doing, and that's my goal right now in reaching out to healthcare professionals and students and others. It'd be great if we could start moving forthwith to adapting to climate change and trying to mitigate climate change, and hopefully we're going to do that. And I think some of us are doing that, but for the larger population, let's just try to get it to the top of our mind. And that's what I'm doing in my household and my family now.
Well, I can tell you that the Division of Public Health for the Central Mass Regional Public Health Alliance has been exceedingly busy this past year because of the threat of the arboviruses, the mosquito-borne viruses, particularly Triple E, and also West Nile, which we ascribe to having a mild winter last winter that allowed so many of the larvae and mosquitoes to make it through, so there was a much higher number of mosquitoes to contend with this past year. And my warning to our community, because we ended up, through the efforts of the Mass Department of Public Health, is coming out with the recommendation that evening activities be curtailed during this endangered period. We had 11 cases in Massachusetts, and there were a total of 5 fatalities. So it had a very high lethality rate in the patients that knew that they had bad symptoms. We said, stop football practices, stop evening sports activities. Restaurants should not have people sitting outside in the evening in what ordinarily is a very nice time of the year, August, September. And I've been saying a lot of media interest in this, whereas it used to be a cyclical thing, that we would see these arboviruses pop up like every 6 or 7 years. I'm very concerned that next summer will be the same, and that this is the new normal.
Yep.
And if it's borne out that we don't see the cycle anymore, that instead the mild winters are going to propagate these mosquitoes, that's just one little piece of climate change or global warming that's affecting us right now. And it's not just those kind of insects, it's ticks. And when is the hard frost coming? I never saw so many people interested in a hard frost this year. And we had one 2 weeks ago and could reverse the outdoor recommendations. But this is, I think, when it starts to really hit you, when your kid can't practice his sport, and when he may not get into college because he doesn't have a college scholarship because he hasn't been able to practice, or work as a waiter in an outdoor restaurant or whatever. These are the things that I think really start to wake people up.
Right.
And I think we've got to point out these little changes, little seemingly little parts of global warming, and say, hey, this is the deal. This is part of the deal.
Yep. Well, it is the new normal, Mike. There's no question about it. Whether you're talking about tick-borne or mosquito-borne diseases, or heat-related issues and the need to curtail football practices because of the heat, or to have heat warnings now for our elderly population, and making sure air conditioners are in the homes of the elderly and so on, where they previously were not. But I think we have to step back, and you're doing exactly the right thing, and you and the Department of Public Health here in Worcester deserve a lot of credit for that, because you're talking about what we need to do to enhance our infrastructure of public health and transportation. And by you as a leader in the world of public health in this community speaking out about it, brings us to that point of adaptation. Now, and not all departments of public health, whether in smaller communities or larger communities, are doing that yet. So the fact that Worcester is doing that and leading the charge and doing that is really what we need. And the challenging part is that, yes, it is the new normal. We don't know exactly whether it's related to heat or to tick-borne diseases, whether next year is going to be better or worse. But we can probably commit to the science of the fact that over a 5 or 10 year period, it's going to be certainly the new norm, that we're going to see more tick-borne diseases, that we're going to see more heat emergency days, and more flooding and more severe storms, whether it's the Arctic freeze coming down and hitting us this week apparently, or the warm weather that is going to be affecting us. So yes, it's the new norm, and more of a reason why we need to have sessions like this where physicians can talk to each other about it and get the word out to other physicians, but certainly to the community. If we could put aside the politics of it all, and come together, whether it's the right or the left, the Democrats or Republican, I think we could all agree on the fact that if we improve our infrastructure from a public health perspective and transportation, that is going to do a tremendous amount to address this issue of climate change. It's significant, and that should be not controversial.
Right.
There's no controversy in that. And that's what I offer as, to the communities and to the legislators out there. Just get your transportation going better. Just get your public health departments. You talked about in the earlier segment about the lack of funding towards public health departments, whether it's small or large. And that is the case. We need the funding to communicate these messages.
Right. Well, we're very fortunate here in Worcester that, our city managers have really helped to finance a lot of our electric buses, and we have some really great hybrid kind of transportation out there. Not enough, and we know that that's a big issue in terms of looking at our community health assessment, that are some of the reasons that our community can't access health care the way they would like is because it's tough to get around without a car. But I think that these kind of discussions should be in the forefront of major medical organizations. I mean, we just filmed a segment that you referenced about vape lung, where 3 deaths in Massachusetts caused us to shut down vaping sales, right? But thousands and thousands of people are being affected by millions of people by this climate change, whether it's flooding or polar ice cap melting, or the fishing industries, or sharks on Cape Cod. I mean, there's so many manifestations of this, and we don't seem to have the same, I think, collective will to kind of intervene. And I think that there's a lot of talk about, you're going to put millions of auto workers out of work, or you're going to, what about the coal miners, or what? There's really got to be a shift to the kind of work that those really able-bodied people can do to help us get green.
Yeah, and on the commenting on the hope of getting to a better place. Despite the United States being the only country on the planet to now step out of the Paris Accord, there is a great effort in the United States. Not only with the research being done, but with cities across America. Here in Worcester, with your leadership in the Department of Health, taking on the educational end of it. Renewable energy is out there, is creating jobs. I believe, and I think we all need to believe, that we could engineer ourselves out of this, as we have been able to do in many other areas of healthcare or industry or communication or education over the past decades in the country. If there's any country on this planet that can engineer oneself out of this, and whether it's the country or the rest of the world, it is the United States. So I think we need to be hopeful of that, and I think we could do it.
Well, it's a great message to hear, because I think people have been so kind of resigned to the inevitability of just like fading away in this, like, what can I do, or what can I do?
And that was the benefit of this coursework that I took. I really wanted to find a program that would really allow us the opportunity to learn how to better communicate this information. You in public health, and certainly in the years that I've been doing public health, we have learned that you and I may feel we have the absolute best program to offer to the community, but for some reason the community is not buying it. So it all comes down to communication. How can we inform the public of this issue of climate change? And one way to do it is try to step away from this fear factor, because that puts people off. People just stop dead in their tracks. They are fearful. They're not going to do anything about it. They just turn it off. And if they hear also that of legislators dismissing climate change, that's another reason why they're dismissing the issue of climate change. So I think we know that in the study of climate change, the best thing we could do is learn how to communicate the issue, talk about the values of climate change versus the science of climate change. For some reason, there are reasons, which if we have time we could talk about it. People are not taking up and trying and believing the science behind climate change, and there are reasons for that. But we all love the outdoors. We all want to see our children grow up to be healthy and strong. We all want to move better in this world of transportation, and we all share that, whether we believe in climate change or not. And if we all have those similar values, then I think we could get to a better place.
So I'm going to challenge you a little bit, not that I don't agree with everything you've said, but all right, we're sitting here in a town with 2 major medical centers.
Yeah.
They service a population together of probably 1 million people, right? So if they decided that they wanted to be a paragon of green, or a real ambassador of climate change is real, A, could it be done? And B, would it have an impact? Do you think it would have an impact?
That's a great question, Mike. And we've talked about the role of healthcare systems in so many areas, and this certainly is one. Absolutely, most definitely. In addition to lecturing within the UMass system, my hope is to get to the hearts and minds and ears of the administration at the senior level, and hopefully this session will do that for us, to start thinking about having healthcare systems reduce their carbon footprint. And there are other healthcare systems in the country doing that. Yale University is taking the lead in that. The Department of Anesthesia at Yale University is taking a deep look at how they affect the environment with the gases they use, with the equipment they use. So it's being done. And it could have it would have a dramatic effect. Because in some ways they have to do it, because in 10, 20 years from now, whether it's the business of healthcare or the industry of cars or automobiles, or you pick your industry, they're going to have to move in a way that's going to be very financially impactful to them. They could reduce that now if they start addressing the issue of climate change, and it could have a relatively quick and immediate impact. There are things that an institution such as a healthcare system can do immediately, whether it's education or within their own facilities, to have a very quick effect, low-hanging fruit, and demonstrate the benefit of that and the cost savings to that, and then build upon that. So I feel that if healthcare systems are really going to be for health, climate change, global warming is a significant factor. And my advice to healthcare systems is do it now, and don't be forced to do it 10, 20 years from now, either through regulations or through the cost of healthcare that you're not going to be able to bear because of the issues related to climate change, health issues related to climate change. So that's a great question. And really, my goal is to get healthcare systems and healthcare providers like us to start thinking about it and reacting to it.
So I'll tell you, just a couple of weeks ago at the American Academy of Pediatrics meeting, they made an announcement that they were no longer going to have live meetings twice a year for many of their sections and councils and committees, that they were going to use the very high-tech virtual meeting capability that they built into their new headquarters in Chicago to allow people to connect that way virtually. And I think, that's thousands of people on airplanes and all different kind of travel, and that I think is going to be eliminated, which I think is a sign that the ice is breaking in your favor, that the people are, I hate to use this word, woke about this, The other thing I would say also is that surgery meetings, which aren't really known for, climate change stuff, I've seen now several presentations that residents have done where they cataloged how much waste was in the packaging in the OR. You know, like the packaging in the OR is so redundant and so ridiculous, and it's totally accruing this huge carbon footprint just for an individual case, and you multiply that by 1 million a day, you know, and you end up realizing how little things could make a difference. You know, the way we take care of our instrumentation and everything else.
Right. We see it in our own homes. You know, if we go out and buy that hybrid car, or if we start looking at in our homes and look at our electrical bills. I mean, how many of us really look at our, you know, online or our hard copy electrical bill and analyze it and see, you know, where we are month to month, and review the suggestions these electrical companies make to reduce the amount of electricity we use, and thus fossil fuels. We really don't. So something as simple as that would be beneficial. Yeah.
Well, I know we could talk about this topic for days and days and days, and I think you're doing such a service to the community and to the medical community in particular to kind of make this a priority. Once again, you're like miles ahead of the curve always. I think that for the public out there, what would you say? Just we only have a minute left. How could they find out what they can do? Is there a website or anything you could recommend?
Yeah. I mean, what we should be doing as adults is one, think of our children, and we adults go online to look up every conceivable thing that negatively affect our children. Do the same thing for climate change. And there are recommendations, you know, you go onto the CDC and there are recommendations for parents. You go on to the American Academy of Pediatrics, there are recommendations for families there. Public health departments. So that's what parents could do. Just go online.
Thanks. Yeah. So thank you very much for watching. This is, again, Health Matters, sponsored by the Worcester District Medical Society. Thanks to our guest, Dr. Matthew Masiello. Thanks also to WCCA TV for putting this on. I'm your host, Mike Hirsh, and I will be back hopefully for more shows in our 225 anniversary year. If you're interested in supporting WCCA TV, please look us up online. You can even text 243-725 and ask to give a gift to WCCA TV. And good night. Have a great week.